Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
I am Dr. Kushal Agarwal. I am a neurologist. I'm working as a consultant neurologist at Gondia at my own hospital, Neuroplus Clinic.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Yeah. See, seizure is basically a abnormal electrical activity in a brain. So, if it's a single episode, we usually call it as a seizure. And it is basically an abnormal excess electrical activity in a brain that we call it as a seizure.
What is epilepsy?
See, epilepsy is basically if there are multiple episodes of seizure, if it's a unprovoked episodes and it which is 24-hour apart. So if the two episodes of seizure which is unprovoked and which is 24-hour apart, we call it as a epilepsy. See, what is unprovoked? Unprovoked means there is no underlying cause for the seizure. Like if the patient did not have any decrease in the sugar level or decrease in the calcium level or hyponatremia or any underlying brain infection. If that is the condition and which leads to a multiple episodes of seizure, then we call it as a epilepsy. So in general terms, in day-to-day practice, so more of seizure and epilepsy are generally used as a single, as a same term, but as a professional, we need to differentiate. We need to know what is basically a seizure and what is epilepsy. So that is important for us.
What are the different types of seizures and do they affect people differently?
Yeah. See, seizures are basically divided into two headings. Like one is a focal seizures and one is generalized seizures. So for the basic thing, generalized is when the whole brain is involved. We call it as a generalized seizures. Both the part of the brain, the right hemisphere and the left hemisphere. And if it's a involvement of the single hemisphere, though, then that is or single hemisphere or a particular part of a single hemisphere, then we call it as a focal seizure. So we need to differentiate what is generalized and what is focal seizures because the treatment is different and the drug of choice, the drug which are used in a generalized and which is used in a focal seizures are basically a different. Drug of choices are different. That's why it is very important to know whether it is a generalized epilepsy or whether it is a focal epilepsy. In further line, epilepsies can also be further divided into various types like simple partial seizure, complex partial seizures, and same wise, the generalized epilepsy can also be divided further into a tonic seizure, or it's a myoclonic jerks. So they both can further be divided into number of classifications, but that is important for the treatment purpose. So it's very important to differentiate focal seizures from generalized epilepsies.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
No. See, the epilepsies basically are basically the epilepsy is an electrical activity which arises in the brain because of the various reasons. Like patient might have underlying brain infection or brain tumor, or patient can have a stroke. These are the very common causative agents or head trauma. Sometime in a patient's there can be a hypoxic brain damage in children's born to a mother during a delivery, and sometimes it can be a decrease in the calcium level or decrease in the sodium level or increase or decrease in the calcium. So there are n number of factors which need to be seen whether it's a causative thing which is leading to a seizure, because if you treat a causative factor, the seizures can be stopped. So sometimes seizure can be it can be the cause. The seizures might have a cause, and sometimes if there is no cause, then we call it as a idiopathic. Idiopathic means there is no cause, and in that condition, it sometimes it can be a genetic epilepsies. Genetic epilepsies means certain genes are leading to a seizures. So sometimes seizure patient can have a family history, but it is not always that the family history will be present. So it is very important to rule out what is the causative agent for the epilepsy or seizure to treat accordingly. So it's very important.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
See, what exactly happens in epilepsy is patient has a tonic-clonic movements, patient has a jerky movements, patients sometimes has a ictal cry, sometimes patients has a fearful faces. So most of the time, what happens, the person or the relative which sees this, such patients, they feel that something extra have been happening to a patient, and that is very fearful to somebody. So if they thought that if this patients with epilepsy, if he might touch to somebody or he might play with someone or he might be employed somewhere, so the chances of having a seizure to other person is there. So they thought it is a communicable problem. The person with whom they are sitting is having epilepsy, they might can have this epilepsy. So there is a social stigma. They outcast such patients. They usually don't employ these patients. The children's usually, the parents usually hide these epilepsies because they think if this epilepsy thing is known to a society, then they will outcast them. So this is basically a stigma. So it is very important from for the point of view of doctor that the means awareness, the social awareness regarding the epilepsy to a patient, to a relative, to a social activists or the persons which are there in nearby, that we need to explain them that seizure is just a pure medical pure neurological problem. It has nothing to do with any extra or any superficial thing or any baba, and it means they were like कि ये कुछ अलग से हो गया है, तंत्र मंत्र करना पड़ेगा. They don't even treat such patients. They take that these patients to a taboos, and they do something else. They don't prefer going to a doctor. So this is very important. So this is the stigma that we need to consider.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yeah, see, the triggers which are very common are the basically the sleep. The if the sleep is deficient, the chances of having a seizures are more. If patient is under n number of stresses, then the seizures chances are more. If he did not have a proper meal, is not taking the meal or eating the foods properly, that is one of the common cause of seizure. And one of the common causes of seizure are if the patient is not taking the drug properly. So that is very important. The patient should be explained about the compliance regarding the medications. So these are the 4 5 things that are very common triggers for the seizures.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yeah. See, if the patient is having a seizure, the most important thing is that the patient should not, the relative should not put a water into the mouth or should not put any fingers or spoon or should not use the onion and anything or should not use any shoes or anything while patient is having a seizure. The most important thing is just turn the patient to one side so that all the secretions are drained out, so patient should not aspirate. That is the common thing when the patient is having a seizure. Do not the relative should be explained that the patient, if patient is having a seizure, don't allow the all the persons to be nearby the patient. They let the patient take the proper air, let the patient take the proper oxygen, so that patient do not succumb to a hypoxia. One thing. Second thing is, if you know that the patient is having a seizure, he might have a seizure anytime, so do not use the sharp objects at home. Use the proper mats at home. So if the patients fall on the head, he should not have a head injuries. So these are the basic things, the sharp objects, these are the basic things that we need to consider, need to explain to a relative if the patient is having a seizure.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.